Well, welfare reform is something I worked on when I was governor. The Democrats were in control of the legislature. We passed comprehensive welfare reform, and I think that what we need to say to the folks who are on welfare, that this will be happy to help someone temporarily. But welfare should not be a permanent way of life, and I think people who are able-bodied and able-minded ought to work in exchange for their benefits. And if they don't get a job, then do community service work. And that's a way of reducing fraud and people who are on welfare who don't need to be on welfare. More importantly, I think we need to promote the work ethic rather than reward idle behavior. And when people have a job, there's a dignity to having work, and it's a good role model for their children as well. So I'm one who thinks able-bodied and able-minded people ought to be required to work in exchange for their benefits, and welfare should not be a permanent way of life. We want to move people to independent, self-reliant lives.
I think we've made a lot of changes in the last 15 years to a welfare system that occasionally benefited people that shouldn't have taken advantage of it. For example, we've imposed work requirements for most people before they get welfare, any kind of a welfare payment, and that was something that we should have done. I think going forward, much of the welfare reforms that continue to be made are actually ending wasteful payments. So, for example, in Medicare, an entitlement program that provides a medical benefit for seniors, one of the biggest examples of waste is when we buy prescription drugs in that program, we overpay pharmaceutical companies. The law does not allow us to negotiate over pricing to get the volume discount that any business would negotiate. If we were to eliminate something like that, we could save $24 billion a year. That's an example of waste, or what I would call corporate welfare. We don't need to overpay for prescription drugs. We could save money, help the deficit, and maintain a high-quality health care program if we eliminate wasteful spending examples like that.